Good morning all, welcome you to today's video. Today we are going to discuss the waves and intervals and segments in the ECG. You remember 443. So there are 4 waves in the ECG and the nomenclature starts from P. So one wave is P, then QRS, then T, then U. Then there are intervals, again 4. There are 4 intervals in the ECG, PR interval, QRS interval, QT interval and RR interval. Then segments are 3, PR segment, ST segment and TP segment. Alright, so we'll first start with waves. So waves, the first wave is, as I said, it will be P wave. So this is the P wave. Now P wave, since you know that the atrial activity, the pacemaker activity or the electrical activity heart starts from the sinus node which is situated in the right atrium. So, and then it will depolarize the whole atria, alright, through the different bundles. And the general mean vector of the atrial depolarization is down and left. So, P wave is an atrial depolarization wave. Always remember, these waves are depolarization wave, not the contraction. Contraction is a mechanical event and ECG is an electrical event. So, depolarization is an electrical event. So P wave is atrial depolarization. Now since atrial muscle is very thin, so P wave will be very small in amplitude. So it is a smooth and small in amplitude. Alright. And because why it, and since it is slow also little, because there are Purkinje fibers present in the atria but very small minuscule amount as compared to the ventricle. So conduction is not fast. So it is a little slow, smooth and small deflection, and this is above the baseline. So if I take this as a baseline, this is above the baseline. So it's a positive deflection. Alright. So as I said, and one more thing, since the atria depolarize longitudinally from one point to the next point. So this is the next point, this is Y point. So atrial depolarization will start like this. So first this point, then. So by the time the depolarization is there to the Y point, the X point will be recovered. Okay. So in the electrophysiological laboratory, it is very easy to induce atrial fibrillation because at this point you can stimulate it. So another wavelet will start and this will go on and create an atrial fibrillation. And because of this very reason that it is a longitudinal and contiguous depolarization, the P wave, atria, we say atrial enlargement. Most of the time we avoid saying atrial hypertrophy because the transmission of the depolarization is not like this. It is mostly like this. Whereas in the ventricle, the depolarization wave spreads transversely throughout the ventricular muscle from endocardium to subepicardium. So we say ventricular hypertrophy, and the ventricular depolarization is synchronous. That means both ventricles contract almost at the same time. So it is a powerful ventricular depolarization. But let's stick to atrial depolarization. So atrial depolarization is a small positive amplitude wave. Now the general direction is down and left. So most of the leads will record a positive deflection. You know, lead 1 is on the left side, the positive pole is on the left side. AVL, the positive pole is on the left side. 2, it's at the 60-degree positive pole on the left side. AVF, the positive pole on the left side, you know. And even the lead 3 positive pole is down, but on the right side, but it is down. So in general, the direction is down and left. So most of the leads are going to record a positive deflection. Alright. And in AVR is a lead which is an augmented unipolar lead from the right side. It is looking to the cavity of the heart. So all the complexes, be it P, be it QRS, be it T, will be negative in AVR. So we'll leave at this point that AVR, all complexes will be negative because all the depolarization is going away from the AVR lead. So P wave will be like this. Now what about V1 lead? V1 lead is situated on the right side of the chest. Alright. So when atrial depolarization starts from right atrium is little anteriorly. So V1, the right atrial depolarization moves towards the V1. So it will record, like this is the baseline, it will record a positive deflection. Okay. But then the depolarization is moving towards the left atrium, and left atrium is little posteriorly. Okay. So and inferiorly, so it is going down, but it is going towards the left side. So now V1 senses it as if the depolarization is moving away from it. So V1 will record a negative deflection. So it is a biphasic deflection in V1. So V1 is the only lead which will record two components, right atrium and left atrium depolarization separately. The positive complex will be of right atrial depolarization, the negative complex will be of left atrial depolarization. So it is one of the best, lead to sometimes pick up the rhythm disturbances. Alright. So now even this P wave, the single P wave that we see in most of the leads. Can you please show here? I can just show here. See, this is lead 1, positive P wave, lead 2, positive P wave. Alright. AVR, as I said, will be negative, and lead V1 has a positive and a very teeny weeny a negative deflection. This is the baseline. Alright. So most of the lead 1, 2, 3, AVR will be negative, of course, then AVL positive. So most of the limb leads are having a positive deflection of the P wave, because the direction of the depolarization is 40 to 60 degree down and left, okay, of the P wave. Now this P wave, you see, because since they depolarize almost at the same time, it electrically they behave like a single chamber, although there are two atria, right? But depolarization will be single, because they are behaving electrically as a single chamber, be it atria or be it ventricle. They behave as single chamber when it comes to electrocardiographic recording. Alright, but still, first half of it in the P wave is right atrial activation, and second half will be left atrial activation. Alright, now so this is the first wave, P wave. Alright, and what is the duration of the P wave? You remember 2.5 segments, 2.5 small segments. Alright, and we know one small segment is 0.04 seconds. So it will be 0.04, 0.04 and 0.02. So it will be around 100 or 110 milliseconds. That will be the duration. And what is the height of the P wave? This is 1.5 millimeter. 1.5 millimeter. That means one small segment and half small segments. That will be the height of P wave. These are the normal dimensions of a P wave. So you should remember the normal dimensions. Now at this juncture only, I'll guide you to some abnormality. So you can see, now this is a P wave. Okay, the first half is right atrium and the second half is left atrium. So if right atrium were to enlarge, if there is an enlargement of the right atrium, now this is a left atrium, so only this part will go like this, okay, because it doesn't have a space to go here. Alright, so it will go like this. So P wave becomes peaked. P wave become peaked, not like exaggerating, it will become like this. So how we diagnose right atrium enlargement? By amplitude, by high amplitude. So that will be beyond 1.5, mostly 2 millimeter or above, and mostly they are visible in inferior leads. Alright, if we come to chest leads, what will happen in the chest lead? So in chest lead, this is the first component and this is the second component. So naturally this is the right atrial component, so this will go and enlarge. So it will go like 1.5 millimeter around. So this will be right atrial enlargement. The first component will go high. Alright. Now when it comes to the left atrium, so what will happen to the left atrium? Now this is a P wave. This is the left atrium. If left atrium enlarges, it will enlarge like this. Alright. So what will happen? The duration of the P wave will increase. So it will be more than 2.5 small segments, that means more than 110 milliseconds. Alright. Then since it is a right atrium and only left is enlarged, there may be a notch in between. So this is also called P mitral, which is because it's an M-shaped P wave now, and it is especially visible in inferior leads or in any of the limb leads. Okay, so this P mitral is an enlargement of the left atrium, and the duration of the atrium P wave will be more than 2.5 small segments, and there is a notch in between, and even the notch distance is a small segment or more. So it will be 0.04 second. So the distance between the notch will be more than one small segment. So this is the left atrial enlargement. Alright. Why do we call it P mitral? Because mitral stenosis, rheumatic heart disease, is very common in India. And in mitral stenosis, what is happening? The valve is stenosed between the left atrium and the left ventricle. So blood is not going from left atrium to left ventricle easily. So left atrium, the pressure builds up, the volume builds up. So left atrium enlarges. Alright. Then how you diagnose left atrial enlargement in a V1 lead, because V1 is having both components. So first component will be normal, that is one small in V1 it is 1 small millimeter. Okay, so it is 1 millimeter, the right atrial component. The left atrium is also, now this will enlarge, this is also 1 small millimeter. So what will happen is it will go down and become white. This is because left atrium. So the depth will be more than 1 millimeter and the width will be more than 1 small segment, that is 0.04 seconds. So this is also called Morris index, millimeter per second. So how much will be that? More than 1 millimeter or 1 millimeter roughly, and 0.04 seconds. Divided, this is 0.04 seconds. So that is also suggestive of left atrial enlargement. It will be more than 1 millimeter deep, it will be more than 1 small segment. So this is also suggestive of left atrial enlargement. So at this juncture only we have discussed P wave in its entirety, and we will be discussing more and more when we come to abnormalities. So first was our P wave. Next is our Q negative wave, R tall wave, S wave, and the next will be T wave and a very small U wave. So this is QRS, this is T, and this is U. Alright. I am discussing only waves, not, mind you, not segments, not intervals in today's lecture. And waves also, we have done complete atrial depolarization wave, that is P wave. We will be discussing QRS in detail in the next class, but this is just to show you number 1 P wave, number 2 QRS, number 3 T wave, and number 4 U waves. And U waves is a very small wave, positive complex, and it is like so much, kind of attached or associated with T wave that sometimes it is very difficult to differentiate it from a T wave. And mind you, U wave is not always present. Okay, U wave is not always present. So this QRS is a ventricular depolarization wave, and T wave is a ventricular repolarization wave. Okay, T wave is not a depolarization wave. So T wave is a repolarization wave, and U wave, we don't know how it comes. We don't know. Earlier it was thought to be due to Purkinje fiber depolarization. Now they say there are some mid myocardial M cells, that is a depolarization. So basically U wave, we are not very sure, but it's a very small wave and it is mostly positive in chest leads. It is found mid precordial chest leads. For today, I think this is enough. Next class, we will be discussing the details of the ventricular depolarization, that is a QRS complex. Okay, and after that we'll discuss more waves. So stay tuned and keep watching, keep learning and spreading the knowledge. पढ़ेगा इंडिया तो बढ़ेगा इंडिया. जय हिंद, जय भारत. Thank you.